Hello, I'm Susan Moore for Spirit of Women and Banner Health, and we Spirit members are so lucky to have the best doctors. Dr. Rubatt is with us today. Dr. Rubatt, you're a gynecological oncologist.
Correct.
Did I say that right?
You did, I did.
Tell me what your field covers, what you do.
Sure. So I am a specialized physician that takes care of women's related cancers, except for breast. I don't do that.
Okay.
So primarily is uterine cancer, ovarian cancer, cervical cancer.
So what kind of treatments do you do for these cancer patients?
Sure. The treatments can be somewhat multidisciplinary. So depending on what type of disease the patient has, there'll be different treatment options available. Our most common gynecologic related cancer is actually endometrial cancer,
Okay.
which is a cancer of the lining of the endometrium or the inside of the uterus.
Mm-hmm.
It is actually very curable with surgery alone. Sometimes the patients may need a touch of radiation afterwards.
Okay.
Other cancers, such as ovarian cancer, need to really be treated with a combination of both surgery and chemotherapy together to really fight that disease. And then other types of cancers, like cervical cancer, will use primarily radiation with a little bit of chemotherapy that helps the radiation works better for their treatment.
What are your recommendations to encourage a healthy reproductive system? Are there things we can be doing?
There are always things that you can do. It's really kind of basic, but I think it's always good to remind people the thing to keep your reproductive tract healthy is really to keep your whole body healthy. And there are many ways to do that. Things that people can do for themselves are make sure they abstain from the use of tobacco products, maintain a healthy weight, get plenty of exercise, and those are kind of basic things to help maintain good health overall, including that of the reproductive tract.
What symptoms do your patients have that would send them to see you?
Sure. It depends what type of cancer they might be afflicted with. So one thing that is something that people should pay attention to is for postmenopausal women, if they've gone a whole full year without having a period at all, and then have a new symptom of a new onset of vaginal bleeding, that can be a sign that there may be the cancer developing inside of the uterus. So that would definitely be something that women should go see their physicians about. Another bleeding symptom, if they have bleeding after intercourse, can be a sign of cervical cancer. Okay. So if that happens on a regular basis, the patient should seek attention of a physician. The biggest kind of mystery in what I do is for ovarian cancer. Ovarian cancer usually doesn't present till it's in advanced stages, and the symptoms are very subtle. A little constipation, a little bloating. It's things that women have commonly, right. So we tend to not give those symptoms much credo. But if a woman's having an increased fullness or belly pain or constipation or bloating that's extended for a 2 to 3 week period, that should be a sign that they should probably see a physician for some workup and an examination.
Okay. Well, I thank you so much, Dr. Rubatt, and I understand you're the new kid on the block.
I guess I am. I've been here since October.
Oh, and do you like Colorado?
I love Colorado.
I know we all do. We're so happy you're here.
Thank you.
Dr. Rubatt, gynecological
oncologist.
And I'm Susan Moore for Spirit of Women and Banner Health.